We are now ready to welcome our dear member of the ASF community, Ana Maria Salazar, in a live discussion panel with Dr. Alejandro Macias, infectious disease expert and influenza commissioner, and Dr. Mauricio Rodriguez, professor at the UNAM Medical School and spokesperson for the UNAM COVID-19 Special Commission. At the end, we will have time for questions. So if you have any, please share them in the Zoom chat. Thank you very much for joining us. Have a nice rest of the week.
Good morning, everyone. I'm Ana Maria Salazar. I'm an ASF parent, and I really appreciate the Parents Association allowing us to do this panel this morning. And we're going to be talking about, I guess, the topic that everybody's talking about these days, and we're going to try to answer many of your questions. Before we start, let me just say a couple of things. One, I know there's a lot of questions in regards to what's going on with COVID-19 worldwide. What's the latest information in regards to COVID-19 and treatment and the vaccines? I'm going to try to answer some of those questions. But what I would like to do in today's forum with these two extraordinary guests that are going to help us better understand what's happening is I'd like to focus on Mexico City and trying to answer very practical questions that will help us make decisions and better understand what is going to be happening with the school, what's going to be happening to us, what's going to be happening with our families in the next couple of weeks or the next 6 months. So we are starting to take, if you have questions, please start writing them down in our chat. However, between the doctors and I, we started choosing some of the issues that we absolutely think we need to address, and we're going to focus on Mexico City, where at least what is the status of the COVID-19 pandemic in Mexico City. So have patience with us as we try to go through some of this information and as we try to read through your questions and your comments. We're clearly going to try to start towards the end. We'll start trying to understand better what is the policy position of the Mexican government in regards to schools and the reopening of schools. So we will definitely address that question. Before I start, I want to just mention that both Dr. Macias and Dr. Rodriguez have been frequent guests on my shows, both in English and in Spanish. And the reason why I appreciate so much their participation on both my radio show and my TV show is that not only are they medical doctors, they attend patients, they're practicing medical doctors, but they're also understand and for different reasons, professional reasons, have a very good grasp of policy, and which makes it easier to understand what is going to happen towards the future. My experience in the last, since January, since I started interviewing them, has been, and other experts, is that we all have a lot of information about what's going on, but we really need to focus on the information that is verifiable, or at least somehow there is an expert or an expertise or an organization behind it. There's a lot of information out there that I think we need to be very careful, even retweeting or sending through WhatsApp. And two, I think that there's been a lot of politics injected into these analyses. So what I've appreciated from Dr. Macias and Dr. Rodriguez throughout these all these interviews, like I said, both in English and in Spanish, is that they're very focused on data, right? Very focused on the information that is available and somewhat putting the politics aside. So I would like to start this conversation with Dr. Macias and Dr. Rodriguez, just kind of with a broad question. And I don't know, Let's start with you, Dr. Alejandro Macias. I know you're physically in Guanajuato, right? And in the University of Guanajuato, you're a full-time professor there. Let me just start out with this big, broad question in terms of what is the status of the pandemic in Mexico right now? And and then I'll do a follow-up question to both of you on where's the best place to get, just raw data information that allows us to understand where where the pandemic is going. So, Dr. Alejandro Macias, once again, thank you so much for joining us this morning. Would you like to just give us a very brief overview as to what's the status of the pandemic?
Good morning. It's a pleasure to be with you all. Thank you for your invitation. Well, the situation is bad. You can't hide that. Hospitals are crowded. Regardless any official information, hospitals are not in a good shape. If you need attention, for instance, in intensive care, you will not have it easily. So cases are increasing every day in Mexico City and in a very good part of the national territory. I am in León, Guanajuato, and now hospitals are crowded here also. Sometimes it's hard to find oxygen, even in the dealers. They are out of oxygen. I used to have people with oxygen at home. Now they are hardly getting any oxygen. So we better take a good care. The situation is not good. The situation is not good all over Mexico. The situation is not good all over the USA. The situation is not good all over Canada now. So we are not very different now that in many other countries. What I can tell is that this situation will keep going on, and maybe it's going to be worse with the enter of the winter, because we have to remember that coronaviruses, not only this coronavirus, but all other coronaviruses are winter viruses. So I think that the incidence of the disease will go up and up for December, January, February, and we maybe get a relief in about March, April, or also as psychological relief when we get the vaccination in Mexico. And I think we will not get it before the first 3 months of 2021.
Doc, thank you. That's with that stern warning from Dr. Macias. Dr. Rodriguez, could you help us understand then and focus on the information that we have in regards to Mexico City? Because and you and I have talked about this both on the air and off the air, that sometimes trying to understand the information that is provided every evening during the press conferences by the Ministry of Health does not necessarily put into context what is the situation on the both state levels and city level. So could you just kind of give us a sense as to where we are in Mexico, in Mexico City right now?
Yeah. Yes, Ana Maria. Well, first, let me thank you all for the invitation and for putting all this, I mean, nice community in place to talk about this. Thank you very much also to Pali and the Parent Association, and of course all the community. This is an important problem that we have seen during all the pandemic. The difference between the information from the national perspective to the local perspectives, it's quite confusing sometimes, because if we see the whole map of Mexico and we see all the states and we see this traffic light system, we can get a little confused because we have some places in the green light, which is a low risk zone, and we have places in red light, which is the highest risk of transmission. So to communicate to the populations about the specific risk of their communities, it's responsible, I mean, the local government is responsible for that. And when we see the press conference from the national perspective and from the national overview, we can get a little confused because, I mean, Alejandro said clearly the situation is critical. In Mexico City, the situation is critical. So we have not been paying enough attention to the local authority, which more than twice a week are saying how is the situation, what are they doing specifically, how are they handling the problem, the new actions, the result of the previous actions, how is the I mean, how is the space in the hospitals, what kind of patients, what are they doing there. So it is important to see the situation locally. And as Alejandro mentioned, the situation in Mexico City is that we are having since I mean several weeks ago actually an increased number of patients, both ambulatory and in hospitalization, because they are doing a lot of more tests in the community and they are detecting a lot of more patients in the community. So that increased the number of ambulatory patients, but also they are receiving more patients in the hospital. So we have a sustained transmission in Mexico City, and we have to do something in order to at least slow it down for the next weeks, or I mean, ideally to stop it.
This is a question for both of you doctors. In terms of policy, what is your understanding as to how the government state governments are deciding whether to maintain themselves in the orange status, red status, or green status? And the reason why I ask you this is because there's a sense that, for example, for political reasons or up to a certain point, in order to protect the economy, they have not. Mexico City has not entered into a red zone, or is trying to avoid going into a red zone. So how are the governments, state governments, defining whether to stay in a red zone, orange zone, yellow zone, or green zone? Does that have to do with the hospitalizations, the number of people who require medical care, the number of people who are dying? And two, is it the local authorities that are deciding this, or is it the federal government? Who makes the ultimate decision? I don't know. Can we start with you, Dr. Macias?
Yeah, I think it's both. But I can tell you that by any international standard, all over Mexico will be mostly red, because the international standard is more for the percentage of people that becomes positive when tested. So I think that if you paint the color of a state yellow or green or whatever, it's more like a political decision, because it's clear now that the incidence in Mexico is very high. Just to give you a data, some data, all of the countries in the world, most of them are in the percentage of positivity. They are usually around 10%, 5%. In China and South Korea, they are below 5%. New York now is below 5%. Mexico is above 45%. So if you consider that as the index, then we will be all red. So this has a lot of political injection, but also it's clear that we cannot just close all the activities and that will be the solution for everything. No, it's not. I think that we'll have to go a little more precise to see which activities we have to close, because it's been said, not only in Mexico, but also in the USA and Canada. How is that we have open bars, open movie theaters, but we have closed schools? So
Mhm.
that's not like logic. It's not a logical circumstance. I think that we have to be a little more rational. But what is clear is not that this disjunction, like saying is the economy or is the health. No, it's both of them. And we will have to make decisions in terms of how we will not affect the economy so badly and how we keep going on, like in schools, for instance. If we have closed schools, then we have to have closed bars, closed restaurants, closed gyms, closed places where people is really getting infected.
Dr. Rodriguez, in addition to your opinion in terms of how this traffic light system is working, particularly here in Mexico City, we've also talked about this on one of my shows, that Mexico City is trying to divide the city in a way that they can provide specific support to certain alcaldías based on, in certain part of these alcaldías, based on the amount of what is going on in terms of how they're identifying contagion in different parts of the city. So could you just give us some specifics as to what your understanding is in terms of the policies being implemented in Mexico City, and how effective they are?
Yeah. Yes, well, I want to go back a little bit regarding the traffic light system in general. They are, to define the traffic light system, they're considering some indicators that are stable during 2 weeks from the past 2 weeks. So what we are seeing in the traffic light system is like if you were driving looking only to the mirror, and it's they are not seeing with the traffic light, they are not seeing the real time moment of the situation at the national level. That's why it's very important all the indicators that they have locally and they are monitoring locally to take the decision and to implement all the actions. So that's why the local authorities, they have specific information regarding all the local indicators, and they are taking all the information into the analysis on a daily basis, and they are working with that. What is happening in Mexico City since many weeks ago is that they are they're actually implementing special teams from the public health perspective to work with the communities to identify the positive cases, track them, try to find their contacts at the local level. Okay, and they are finding the communities with the most number of cases. They're going to the houses, they are asking for their contacts, they are asking they are looking about 3,000 houses every week, okay, in order to map all the contagious and all the cases. And they have defined the colonies, the neighborhoods with the most active transmission, and they are putting specific measures in those places also. So perhaps maybe we are not seeing all the measures, but for instance, one market that could be not open for this weekend because that colony specifically, that neighborhood specifically, it's in a critical position, and they're closing that place. And of course, the mobility of the people within the city, it's an important issue because people is going to everywhere, and a lot of people is converging in the public transport, and that makes very difficult to control the situation of the transmission at that high risk situations. And also our relation with the state of Mexico. I mean, they have the most populated municipalities in the country, and to articulate all that response together with them, I mean, it's also very, very complicated, but they are trying to make like a task force for the metropolitan area and to coordinate the hospitals. And uh, in the last weeks, we have seen new measures added to the orange light, like a orange improved or a orange plus light, because we already know what is the red light and what is the damage of the red light situation, which could be in some cases worse than the situation of the disease per se.
We are at 8:27 in the morning, and I'm going to start looking at some of the questions that are appearing on the chat, and some of them are recurrent. Let me ask you a very practical question in terms of what to expect, not only in Mexico, but if we could also talk about in Mexico City in terms of the influenza season. One of the questions we have here is why are influenza vaccines not available for doctors in the private sector? And two, do we have any sense as to how bad the influenza season is going to be, considering that, you know, there's most of the country, or at least, well, let's talk about Mexico City, has a certain level of lockdown. Dr. Macias, would you like to answer in terms of the vaccines being available? You were the influenza commissioner at one point, so maybe you can give us a sense as to where that is, what is going on with the influenza season and the influenza vaccines.
Okay, just 30 seconds to make clear something about the traffic light system.
Okay.
The government has to provide an information of free hospital beds, ventilators and stuff. But I just can tell you one single indicator that we can all have. For instance, how many empty intensive care unit beds do we have in high quality hospitals? To me, that's the best indicator. How many empty intensive care beds do they have in the ABC hospital, in the Humana and in the Angeles hospitals, in Nutrición, and in the INER? They have zero. Okay, so to me that's a better indicator, and that's happening all over Mexico. I'm not telling that this that the authority is cheating. No, they have some data, but we know better. Because, for instance, if I want to send a patient now to an intensive care hospital here in León, Guanajuato, I will not have the bed. So the situation is very bad. We will be in red for almost any indicator the world over, okay? So what are we going to have about the flu season? We have to be ready for the worst, but maybe it will not happen. It didn't happen in Argentina, in Chile, maybe because they vaccinated a lot for influenza. It didn't happen in Australia. Now they have just left the flu season and they have almost 0 cases. And so we are expecting that through the vaccination and through the actions that we are having for the coronavirus, the flu season will not show up this year. And hopefully, because if they show up together, the flu and the COVID, that will be disastrous for the health system. What's happening with the vaccine? Well, the government usually buys about 35 million vaccine. Maybe Mauricio knows that, know better.
36.
36 million? Okay, 36 million doses. And those are being used for people in high risk, for like elders, very young children, pregnant women. But the vaccine is not coming to the private vaccination centers this year. What's happening? That people is afraid all over the world, and the vaccine had a very high demand the world over. So it's coming almost at zero for private vaccination centers. I think that for private vaccination centers, we will not have the vaccine this year, maybe not before February. So if anyone is in a high risk group, like older than 60, pregnant, having obesity, or having children less than 5 years old, they better go to the health centers from the government. They have the vaccine there.
And there is a list of these public centers, health centers, where my understanding is the vaccine has been available. But unfortunately for people like me, I'm not 60, I'm not pregnant. I may be obese, but maybe I'm not too sure I would be able to have access to a vaccine. But Doctor, it's your understanding, Dr. Rodriguez, that there are vaccines available but you would have to go to a public center, correct? One of these public health centers.
Yeah, and I think, Ana Maria, it's I mean, this case illustrates perfectly that we must focus the vaccination effort into the high-risk groups. This time we have to do that. If the previous years all the people got the vaccine, even if they are not in one of these high-risk groups, this year cannot be the same. This year we have to give priority to the high-risk groups in order to get them protected, because the vaccine works better in them and it has better results when we use in them. And this year was, I mean, was an over demand all over the world. One of the biggest manufacturers of this vaccine is informing to the private medical community that they're doing their best to bring more vaccine to Mexico. This year, the distributors also, they changed the game. Okay, they usually distribute the vaccine among the doctors at their office and in the private hospitals. And this year they decide to increase the price and sold it to other groups. So that, I mean, we are facing that also. So let's focus on the high-risk groups, and let's consider the data that we already saw in Japan, Australia, Argentina, and some other countries, in which they also stopped the flu season with the same measures applied to the coronavirus disease. So mask, this social distance, hand washing, and try to avoid close contact. We will also stop influenza with that measures.
There's a couple of questions about testing, rapid testing, whether the schools would be applying rapid tests. Is a way of reopening schools is applying fast rapid testing. So let me just ask you kind of a broader question in regards to the whole testing policy. How useful is it, and how effective are testing? Dr. Macias.
Yeah, no. Well, to start with, it's not effective at all. Okay, if you get the traditional PCR, which is the molecular testing, you usually get the result 48 hours, 72 hours later, when the result means almost nothing. Now they are changing for this antigen test, which is very good. If you have symptoms, to tell if you are sick or you are not with coronavirus, okay? So you cannot use the test to decide if you will have activities or not. There have been disastrous decisions like those, for instance, in the White House. They tried to do that, and they become a center of super spreading of the virus. It happened here in Mexico in the Senate. They thought that by doing testing, they could work every day in presence. They couldn't do it. Sooner or later, you will get sick people, you will get centers of dissemination. So testing is not designed for that. Testing is designed for checking sick people, looking sick people, finding their contacts, going for isolation, going for quarantine, but you cannot pretend to just take testing and then say, okay, I'm doing my testing, and now I can do traveling, for instance. Now I can safely go to a bar, to a restaurant, whatever. It's not working that way.
Dr. Rodriguez.
Yes, Ana Maria, and I also want to reinforce the idea that we have to trust in the clinical and epidemiological view. Okay, if we have enough data to think that a person has COVID and all the contacts from the previous 3 days must be at least warned that they are they were in contact with this person, and in the cases of the high risk person, I mean, you can go and try to find a test. But once you have the clinical or epidemiological presumption of a case, we have to take actions immediately, okay?
Mhm.
We have to isolate the person, to put a mask, put all the close contacts with the masks, and to start doing the measures in order to avoid the wrong way of the disease. The first 3 or 4 days are critical. Okay, so if we make the right decisions and the right actions in the first 2 or 3 days, we can avoid complications, worsening in that person, and a lot of contagiousness in the community. So it is important. I'm gonna put in this chat the web page of the rapid test kiosks in Mexico City. They are doing 10,000 tests daily. They want to do 20,000 or 30,000 by the end of December. They have enough material. They're trying to have enough personnel, and that would help to shape the epidemic in the local areas. But as Alejandro said, don't wait to the test and don't be panic because of the test, because the information is, I mean, could be late for that decisions.
Now, just do you have any sense, and because this is actually something that is happening right now in Mexico City, and I'll ask you, Dr. Rodriguez, what information do we have with the QR scanners? You know, we're going into stores and we need to have, they scan our cell phones for information. Do we have any sense whether, what is happening with this project? Is it useful? Do we have any results? What do we know about this?
Well, last week was the first complete week with this system. I mean, this QR system consists like a registry entrance in a crowded place, no, a restaurant or a shop or some other places. And the idea is to define a specific time for the stay in that place. And if some of the people that were in that place results positive in one of the tests of the older system, they are going to check where this person was at what time according to the QR registry, and to tell all their contacts that were, I mean, all the people that were in the same place at the same time during a 1 hour period time, and to tell them, beware, because one person in the same place at the same time was, I mean, it sounds crazy in a, like in a Walmart or in a huge supermarket. You can say, okay, we were 1,000 people there, and I mean, how do they evaluate the risk? Perhaps in that level it's a little bit crazy to follow it, but in a small restaurant, that could be useful, or in
Yeah.
specific situations that could be useful. And they're saying that they are having very good results, only measuring and only counting the text messages that they send. So we have to see more specific information and try to find what what do the people with the information that
Right.
they receive in an MSM.
And of course, we got some questions here as to whether our information is safe. We would probably have to bring on an expert.
Ana Maria, I would like to
Yes.
add that those systems work better when the incidence of the disease is very low. Because when it's very high, when a high proportion of population have the virus, then it becomes a complete mess. Instead, if you have only like 0.5% of population with the virus, then you can do a good tracing. But in situations like the one in Mexico or even in the USA, those systems become a real mess. They just, I think they just don't work.
There's a lot of questions in the chat in regards to children getting back to school. There was yesterday there was an article that was an opinion piece that was published in El Universal, somewhat reflecting a conversation that may or may not have taken place with the Minister of Education. So let me start that conversation and ask both of you in medical terms. What should be the consideration of how and when to reopen school? We'll talk about the policies later, but just both of you both are practicing doctors. You're seeing patients. We're all trying to understand the impact of this disease, not only physically but mentally on our children. So, from your perspective, what's your understanding? So maybe we can start with you, Dr. Rodriguez.
Well, we have to consider that 1/5 of the population in this country is related to education activities. So if we want to go back to schools, we're going to put 40 million people into circulation, into the public space. So we have to think very careful how are we going to do that. For instance, at the National University, we have schools with 20,000 students every day going in and out, okay? And we have, thousands and thousands of people getting into the same places. So it is it is a high risk situation, and we have to wait to slow down the transmission in the city or in the country, but mostly here in the city, and try to identify some strategies to detect in a rapid way how will we handle the situation, because we have a huge communities. It's not easy to transform all the facilities to make like this filters at the entrances. It's the proportions of this city, this country, it's huge, and the amount of investment to modify the areas, some places is not possible. So we have rooms with 50 students. Okay, that is a very high risk situation. I'm sure with the rapid test and the track and trace the contacts, we can design a strategy to at least the low risk activities in the schools, try to think in a way to go back to schools, not the whole activities, but that in some other countries they are keeping the schools open. They are seeing that the transmission in the schools is not the I mean, is not the worst place for the transmission. So perhaps with the vaccination, we can make a vaccination effort around the school activities to protect the most vulnerable with vaccines and to define a strategy to detect early the cases and trace contacts. But I don't know. I don't have the complete answer.
Dr. Macias, there a lot has been written as to when Mexico is going to reopen schools, and there seems to be some indications, and I don't know if you've been following or if you're within your conversations with government officials. I mean, it seems that the reopening of the schools is hinged on the ability of Mexico to vaccinate at least a percentage of the population. What do you know about these decisions to reopen school, and does the Minister of Education have to sign off so that the reopen is done nationwide, or do you think it's going to be done
No traigo mi cartera.
at state levels?
34061.
Someone has their
Okay.
microphone open.
Hasta
Okay. I think a problem, Anna, is that tension is very high. So if tension is very high in both political and medical institutions, then we'll have a gap with evidence. We will not attend evidence because tension is very high. Like we know, for instance, for evidence, as Mauricio said, the younger the children, the less the risk to reopen. We could, according to the evidence, open kindergartens, open elementary schools, maybe up to the 5th degree. The older the children and youngsters and teens, the risk is going up and up and up. But what I say is that we need some peace of mind to alleviate this tension. And I think that today we have a very, very good we have very good news from Britain, because they are starting to vaccinate massively with the Pfizer vaccine. So we need to start, as Mauricio said also, maybe the vaccination, not only to cover the population, but to feel some peace of mind, but to feel some peace of mind of medical institutions, because tension is very high there. Tension is very high in political institutions also, and we will not attend evidence if we keep that tension. So if we start vaccination will allow to alleviate the tension, and maybe we will attend more the evidences, because in the situation we have now, I think we will not open the schools, even if the evidence shows internationally that nothing happens if you open kindergartens and elementary schools up to maybe 5th degree. So we need vaccination. Maybe not to cover, as Mauricio said, a big proportion of the population, but just to know, like for instance, doctors in hospitals, nurses in hospitals are just getting their vaccine, and they are not burned out anymore, because now situations in hospitals are very, very difficult. People is afraid, people is in burnout. So if we start getting some vaccine, maybe a little vaccination for the medical institutions, that will help a lot. I think that in the meantime, we will not go back to the school because tension is just very high, and we will not attend evidences.
And Ana Maria, I just want to add that with I mean, regarding this specific topic, we have not to add more tension, because we are seeing some schools that are pushing really, really hard to open against the national consensus. They are doing their best efforts to open their school, in their local terms, and that is not good for the situation, because I mean, we have to move in a, at least in a local, in accordance to the local actions, not the national actions. Because I mean, for instance, Campeche, when they went to green light, they said the federal authority said, okay, if you want, you can open your schools. And the state of Campeche, they say, no, I'm not going to open the schools because, and they have their reasons, no? But it is important to try to see these all these elements and to figure out that we will finish this course in a virtual way, and perhaps with these new elements for the strategy, we can open a hybrid system in the next course, or a full presential activities in the next course.
So
or the next academic year.
is that your analysis, Dr. Macias, that it's likely, at least with the information we have right now, both on the political side, the policy side, and the evidence that we have on the disease, that it's probably nationwide, regardless of the traffic light system for each state, it's probably this whole school year is going to be virtual. Is that kind of your sense?
Yes, that's what I think. I think we will go hardly back to the presence in the schools. It's a difficult decision, more for political reasons than for practical ones. I think that we could start opening like kindergartens. We could go little by little up and up, maybe kindergarten, then the grades, maybe three grades, maybe one more, maybe 50 grade, and going up little by little. But I think it will not happen because, as I said, there's a high degree of tension. And tension is also confronting the political side with the medical side. And so if they, like to say, they open schools and we keep with hospitals crowded, then we will say, oh, this is difficult. How are you opening schools if we have the hospitals crowded? Okay, so we are being confronted with this situation. And as I said, to me, that's going to be very, very hard.
Let me ask you, we're rapidly running out of time. I do have to ask you in terms of what we understand about the vaccines, when there would be vaccines available in Mexico, but more importantly, vaccines available in a way that will have an impact, vaccines available in numbers enough that will have an impact on decisions that are going to be made, not only about schools, but the traffic light systems and returning to some sense of normality. What do we know of Mexico's capability of being able to get these vaccines out and about and make sure that at least that there is some sense that that they have the infrastructure and the resources to do it? Dr. Rodriguez.
Well, first, we have to see that the vaccines, well, there are 3 or 4 vaccines that are in the late stage of the phase 3 clinical trials. They are asking for approval with the regulatory authorities, and they are going to obtain that for emergency use, which means a specific way to use that vaccines in specific groups with specific rules of use. Okay, so it is not a wide use license. And we also have to consider which groups have been included in the clinical trials. In the chat, I saw a couple of comments regarding that there are not children in the clinical trials, and that's true. Only 1 or 2 vaccines are including people younger than 15 years, and most of them, I mean, none of them are including children from 1 to 5 or 6 years. No, not even pregnant, not even I mean, we have to focus on which groups will, which groups will work the vaccine in and what for, okay? And they are defining the groups, the priority groups. There will be priority groups for the use of the vaccine.
Right.
And not very important issue is that if the companies will be in position to supply the demand
Right.
that everybody is having and that all the world is expecting. So, Pfizer, Moderna, they already have contracts in the US and in Europe with hundreds of millions of doses, and we are in line to receive a specific number of doses that will be used in high-risk groups that will be defined these days. Actually, yesterday, Dr. Lopez Gatell shows the cover page of the plan, of the national plan, and we have to be very aware of which groups will be vaccinated first. I mean, we talked about this with influenza vaccine, the high priority groups, and we will have to do the same for the COVID vaccine, because if not, I mean, the vaccine will be not enough for a general vaccination.
Dr. Alejandro Macias, you have the last word. It's almost 9 o'clock. Any comments that you would like to make before in regards to the vaccine and the availability of the vaccine in Mexico? COVID-19.
Yeah, the numbers that we need are different for peace of mind or impact on herd immunity. I mean, for peace of mind and to relieve and to alleviate the tension, we just need to start vaccination, any numbers, to know that people, that healthcare workers are being vaccinated. That will alleviate the tension. After that, to have enough numbers to have some impact in herd immunity, no, that will not be easy. Maybe by the end of 2021, but almost certainly we will have to wait all the way to 22.
Wow. It's almost 9 o'clock. Mark, our executive director, is joining us today. Thank you. Thank you for joining us. There's a lot of questions and comments in regards to the reopening, or what will happen with the what's going to happen with the school, if there's any ideas or if there's going to be any discussion in terms of reopening. I don't know if you want to make some final comments, Mark.
Well, thank you very much, and a special thank you to Dr. Macias and Dr. Rodriguez. Thank you very much for joining us today. Yes, there are a few things that I'd comment on, things that I've seen in the chat, and I appreciate the number of people who attended today. The first is, of course, that as a school and as a private international school here in Mexico, we are proud guests of the Mexican people and the Mexican government here in the country, and we follow the regulations that we are given. So would we like to be open? Of course we would. This has been challenging for everyone. It's been challenging for students. It's been challenging for parents. It's been challenging for teachers who so long to be the teachers that they are in the classroom and find difficulty replicating that always exactly in Zoom conversations. We began preparing back in the summer, spending literally millions and millions of pesos to try to make the school a safer place for when we were given the go-ahead to reopen. When will that happen? As was expressed today, I think it's going to be a while yet. And we understand that, even as we feel frustrated by being separated from our students. As parents, I'm sure, feel the frustration of trying to help their children in ways in which they haven't done before. So again, as I said, the The school is trying its best to keep up with this. As I said, we've spent millions of pesos on preparing the school for the eventual reopening. Millions more have been added to financial aid to support families that are struggling during this period. Because as Dr. Macias pointed out, this is not just a medical issue. Right? This is government officials, it's economists, it's business people, it's entrepreneurs, it's everyone trying their best to help Mexico and Mexican society to make it through this. So again, I think right now the most important question that was asked is, well, what about January 5th? What about January 5th? We fully understand that many families will feel the need to be together during the holiday season. For whatever holiday you celebrate, for whatever brings your family close together, we know that there are going to be a lot of reunions here in the late December and January. Therefore, at a very minimum, it would be irresponsible of us on January 5th to reopen when there's been so much of this going on. I'm not criticizing it. Some of you know, I now have all 4 of my children back in our house, one from Hong Kong, one from Montreal, because their schools have been online for months. And we had a chance to celebrate a little bit together as a family, responsibly, I hope, but together. So January, not a question. As we read in the article yesterday, January, February, March, likely still, as the doctors have pointed out, to be a serious challenge for Mexico, for Mexican medical services and such. And I think that looks unlikely. Do I remain hopeful for some time? I think every teacher, every staff member, every student, every parent hopes for a return to campus as soon as it's reasonably safe to do so. We're prepared to do that when we get the go-ahead. But again, we have to show the respect to the government, to its attempts to control the contagion here in Mexico, to the medical workers who are doing their best to keep up with the threat and those who are being affected by it. Patience is not easy. It frustrates all of us. But again, we have to be thankful. We have to be thankful in the end for a community such as ours that works together, for the PA, for the faculty and staff of the school, for all the parents and students, and I'll even say our alumni who have stepped up to help us in preparation, many of them offering products and services to the school. So, you know, again, the moment we get to go ahead, we're ready. But we do understand the need for caution.
Thank you so much, Mark, because I think it's giving, there was a lot of questions in regards to January 5th, and I think it's giving some kind of guidelines for people to start making not only decisions for the next couple of weeks, but in fact, for the next couple of months. Thank you so much for clarifying that. We have a lot of questions in the chat. We're over time. It's at 9:05. We're going to formally conclude our conversation right now. If the doctors can continue and stay with us, I know there's a lot of questions that people have. So if you could stay a couple more minutes, we'll continue answering some of the more practical and direct questions that people have, especially, you know, we have 2 doctors with us, so we got to ask a lot of medical questions. I just want to say, I don't know if Trish, the nurse, is with us today, but I just want to say thank you, because I went to her in January to talk to her in regards to this very strange disease that was happening, or that I was seeing as an expert, as an analyst in China. And I went and talked to her, and I just said, you know, I'm concerned. Please don't think I'm crazy, but I think this is going to be this is bad. And I just suggest as a parent that you just kind of start looking at what we have in terms of equipment and gel, and just the influenza season is bad. Maybe you should start implementing protocols. And she could have told me, you know, you're kind of crazy. And a lot of people told me I was crazy in January, because I'm a political analyst. I mean, I'm a national security analyst, not a medical doctor. and I really appreciate, because she did listen, and I was able to have this conversation with her. And I know the school took reacted very, in fact, did take very interesting steps without, I think, the school, the rest of the community understanding what was happening. And it was it was within the influenza season protocols. So I do want to recognize Mark and you all, that you all were preparing for this, and we should tell the community even before this was declared a pandemic crisis around the world. So I do want to recognize that, because a lot of us parents come in and have crazy stories to tell you, but I do appreciate that you all took the steps from February. We're already considering what to do. So I don't know if the doctors had the chance to see some of the questions in the chat. One of the questions that is coming up, and I had this conversation with you, Dr. Rodriguez, is can you just walk us through your understanding or how you're explaining to your patients how to trace and at what point do you have to go into quarantine if you've had a contact with a person? Because we had this conversation. So I don't know, could you just walk us through the days exactly?
Yeah.
Thank you.
Well, thank you, Ana Maria. It is a critical point, a very interesting question, because in part, this problem is so big because of the transmission of this virus starts 3 days, okay, before the people start getting sick. And when the people start getting sick with symptoms or signs, fever, sore throat, or headache or something, they have been already perhaps 2 or 3 days spreading the virus. And they have to be aware of that, because in that specific moment, they have to stop their activities and isolate and start doing something for containing the transmission and keeping care of the disease to avoid the complications. So if you find that you are in a chain of transmission, you have to be very clear in which day of the disease or the the disease was the person with that you have contact with, and try to figure out the risk at that point. Okay. And that is very important, because a lot of people come with us and ask, a friend of a friend was in a meeting last week, and after that, 4 days after that, some of the contacts was positive, and we are trying to make a diagram of the contacts, and that is very difficult. So if we are very clear that a person start the transmission of the virus, and 3 days after that it start with signs and symptoms, we can figure out who was with that person, the places, the number of people involved, and we can at least to tell them, okay, call your contacts of these days, the 2 previous days, and tell them that you are now with the disease. We are trying to confirm if it is or not COVID, but anyway, put them in aware. And they have to, also be aware for the next days, because once you get the virus, there are 5 days of incubation period in as an average, in which you will start getting disease. So if 7 days after the contact you do not have any sign of disease, you can assume that you were not infected at that point.
Let me see if I can repeat that. So you start 3 days before you have symptoms, you already are contagion. So let's start from day 1, 3 days before, right? So that's day 1. So how many days after day 1 are you still contagious approximately?
Well, we are saying 10 days after the day that you identify that you are sick.
Okay.
10 days.
Okay.
And I mean, you have to consider the incubation period, which is the time that goes from the moment where you get the virus until you have the disease. I mean, this is in a symptomatic disease. I mean, in an asymptomatic disease, it is hard to find, and we must to consider all the epidemiological information to handle at least the close contacts of the symptomatics as asymptomatics. And we have to put them also in measures of not strict quarantine, but at least to be sure of the social distance, hand cleaning, and use of mask every time.
Dr. Macias, would you like to add to that?
Yeah, I will say about 3 quick points. First, yes, I am witness, Anna, that you were the very first in the media who raised your voice and said, you know, this is coming, this is gonna be hard. And I have given hundreds of interviews in the media, but I remember, at least you were the very first one. And I remember clearly, you said, you know, you will have a lot of requests for interviews, but always remember, I was the first. Please consider my my requests. I remember very well that. In that was maybe January, February. Well, now, in addition to what Mauricio said, I think that it's very important now that we all know that this disease can take you even to intensive care or even to die if you lose your time. Some very important aspect is that we all have to know that this disease has what is called the hypoxemia. You do not know that you are falling into hypoxemia, okay? And that's very important. We all have to have oximeters at home. That's very important. And don't lose your time, because this is very good to know that your oxygen, my oxygen now is, you can see there, 97. Sometimes when you start getting sick, you do not realize your oxygen level is maybe 80, 70. This disease is like that. And then you get from your doctor an injection on ceftriaxone, hydroxychloroquine, you get azithromycin, you get whatever, anticoagulants, whatever, and you lose 3, 4, 5 days. That's very bad, because that's what you are taking your life in risk. Don't lose your time. Once that you have fever, maybe some pain in your throat, some cough, fever and cough, just check, please. Even if you get a lot of medication, check your oxygenation. Because if you get your oxygen, maybe at home, with oxygen in your home, you will not get critically ill. So that's a very important point. In addition to face masking, in addition to trying to ventilate areas. So, because my third point goes to what Mark said, that they are having the school ready. I think that one very important aspect of getting institutions and schools ready is ventilation, because our architectures are not designed for ventilation. And you have to work very hard on that. And this is an instrument. You are spending millions of pesos in preparation, but you have to have one of these in every school class, in every classroom. You have to know that the ventilation is enough. This is a measurement This is a measurement of the CO2
Ventilation.
of the ventilation. If it goes, you can see it's going up now because I'm talking in front of it. It's a good measurement of the level of ventilation. If it goes up to 1,000, that's very dangerous. That's the moment you have to empty the classroom, okay? Because it's becoming very, very, very dangerous. Then if there's not a good ventilation, you are all breathing the same air and you will eventually get infected. So it's going up. You have to go below 1,000, ideally below 750. So you will need one of these in every classroom. They are not expensive. They are cheap. So we have to be ready. We have to know that we will have to eventually open the schools, but we have to be ready from the medical perspective. What my preparation? What are the precautions I have to have? And the school, of course, Mark knows better, but they have to be also ready for the time when they have to open. Thank you.
Let me, you know, this is one of the, I think I've had this conversation with both of you. I mean, I think what has been surprising is it's kind of a psychological thing that we have as human beings, that we don't want to recognize that the danger is there, because if you recognize it, then you understand the disaster that is coming. So sometimes we live kind of in, up until very recently, you know, we just would not accept that we're going to get sick, right? And that has facilitated, I think, a lot of us, I should say, I include, you know, you want to meet with friends, or my kids especially are trying to figure out the play dates and this whole you know, trying to maintain certain like psychological health, but at the same time, you need to be prepared. So let me ask you this: in addition to having the oximeter that you showed us, doctor, in addition to having a course thermometer and paracetamol, what else should we do in terms of being prepared for the eventuality that someone in our family is going to get sick or get very, very sick? So you gave us some suggestions, Dr. Macias. I mean, Dr. Rodriguez, what else would you add?
We have to be humble to recognize the disease in the house, in the early stage. Most of the patients that are worsening and that are having the severe disease, which, by the way, the name of the virus is severe acute respiratory syndrome coronavirus. So it evolves very quickly into a severe disease. I mean, that's what Alejandro was saying. You cannot even realize what is happening, and the evolution and the worsening of your disease occurs in a matter of hours. What we have to be able of identify the patients in the early stage, a thermometer, an oximeter, not to automedication. We have to avoid automedication. We have to identify specific risk in each member of the family: allergies, diabetes, hypertension, pregnancy. I mean, all the specific risk, to try to act in accordance to that. We have to protect the most vulnerable people in our house, in our community, in our family. And we also have to have the numbers of the, I mean, to call in case of an emergency. We have to establish contact with our doctors in an early stage, also to track the evolution. Sometimes the disease is evolving in a wrong way, and the person is not identifying that because, I mean, is not trained on that. So we have to contact our medical doctors. We have to have the emergency numbers, and perhaps if we have a cluster of cases in a house, or high risk groups, we can also have to an oxygen concentrator around, or at least to know who has one or how to get one, or the number of the oxygen tanks that are supplying to homes. And I mean, I think that that is the most critical point, not to delay the attention, the medical attention, avoid self-prescribing. You can
Medical.
delay also the problem
Right.
and make it worsening.
The Dr. Macias, it's interesting because, you know, once if there is going to be an emergency, I think we don't have enough information to react to that emergency. Even if we have our doctor's phone number, I mean, I'm listening to your comments in terms of being able to access a hospital right now and the difficulties there is of accessing a hospital. I guess the question is, how do you develop an emergency plan? Dr. Rodriguez says, you know, you should probably have the phone numbers of to be able to, if you needed oxygen, to be able to know where you can call or access oxygen tanks, among other things. I mean, just to help, let's think of an emergency plan that we can implement. What would you suggest, Dr. Macias?
Well, your emergency plan is not to lose your time, okay? That's the best emergency plan you can have. I mean, if you start feeling fever, cough, you are sick with coronavirus with a very high probability. So even if you go to your doctor, you have to check your oximeter. I can tell you some of my private data. I have attended scores of patients that way. Just keep a look on your oxygen level. Forget about azithromycin, ceftriaxone, hydroxychloroquine, anticoagulants, whatever. Just check your oxygen. If you are above 92, Mexico City, you are in a safe zone. I haven't seen any single patient dying if they took a good care about that, okay? The problem is if you go down 80, 70, and you keep like that for 3 or 4 days, the day you go to this hospital because you feel sick, I mean, you are in a free fall, and maybe they will not get you, they will not get you in a good position. Even if you can have an intensive care unit bed, you will not make it. So your best plan is not lose your time. Have an oxygen, an oximeter like this, and because from time to time I get telephone calls and people tell me, okay, doctor, I went to the doctor 3 days ago, and I don't feel better, so I'm calling you now. What do you feel? Well, I still feel feel fever and cough. How is your oxygen level? I don't know, because the doctor took my oxygen level there and it was 95, but then I got a lot of medication, but I don't know how I am now. The answer is you have to have an oxygen level, an oximeter right now. So that's your best preparation. If you do not allow the dropping of the oxygen in your blood, that's your best preparation. Anything else, it will not work. That's the only preparation you may have.
It's almost 9:30. Let's do this. Dr. Macias and Dr. Rodriguez, any final comments that you would like to give us or provide us, or suggestions before we end this this session? Dr. Rodriguez.
Yes, well, first, again, to thank all the community to open this space, and I mean, we are pleased to help. Actually, at the National University, we are trying to do this with several communities. We have done with several schools, with several groups, and it's very useful to talk about this. So thank you very much, Ana Maria, for the effort, and all the community for the time. I think that during the last months, we have learned a lot of things. We know the virus, we know the disease, we know the social distance, we know the hygiene habits, and what we need to do in the coming weeks is to put all that knowledge into action. We have to keep taking care of ourselves and our communities. We have to identify the sick person and the contacts clinically and epidemiologically. And we have to avoid a complication in the patients. And we have to keep the communication in a technical level, not to polarize, not to politize the themes, and try to help us each other. So I think that will be useful for the next weeks. Try to not travel in the next weeks. Try to keep at home, safe, with the same people all the time, not together with people from other houses. And as I mean, if we can do that during this period, maybe we will have a winter time, January and February, at least in a more controlled way. The epidemic is very intense in Mexico City. Try to avoid all the risk, and we already know crowded place, closed contact are the places with more risk. So try to avoid it, and we are open to keep in touch. And thank you very much, Ana Maria.
Thank you. Dr. Alejandro Macias, final comments.
Yeah, thank you for the invitation again. I think this has been very, very illustrative. We have data for optimism with vaccination, but don't get it wrong. Vaccination will not take us out of the situation we have now. Vaccination is for 2022, the effects of vaccination. Right now, what we have is face masking. Don't go out with your face masking. Any public place, face masking. And a good face mask going from your nose to your chin. Second, keep a healthy distance from people if you can, about 2 meters about it, if you can. If you cannot, always keep there the less time you may have. And third, keep your hand hygienic. Go always with your alcohol in your pocket and keep cleaning your hands. Avoid touching your face. Fourth, ventilate areas if you can. If you cannot, because you are entering the subway wagon, well, you cannot avoid it. Keep there. The lesser the time you may have there, the better. Avoid the crowded areas, about crowded situations. And if you cannot, spend there only the absolutely necessary time to be there and go out, because you are bearing the virus. And finally, have with you always at home, for every family, one of these, an oximeter, to know that if you get sick, your oxygen level is always above 92 in Mexico City. Okay, that's my final remarks.
Thank you. Dr. Rodriguez, Dr. Macias. Mark, I don't know if you would like any final remarks.
No, just again, I think as a community, we're strongest when we're open, we're transparent, when we're sharing the best information we have with each other. So again, thank you, doctors. Thank you, Dr. Rodriguez, Dr. Macias. Thank you so much for coming. Ana Maria, a special thank you to you for hosting today. It's been absolutely wonderful. So to the community, let's make good choices. Let's stay as safe as we can. But also, never forget that it is community that gets us through that. Community in the family, community in the school, and we will get through this together. So thank you all very much.
And I want to thank the PA, Pali, all of you for organizing this, and we'll do it again as we get through this and as more information comes through, and we have more details as to how we're going to move forward next year. Thank you so much. It's 9:31. This is, I think, one of the longest PA meetings, and we still have a lot of folks here. Thank you. You all have a great day. Pali, thank you. Thank you so much.
Thank you,
for-
Ana
for
Maria.
helping
Thank
us
you.
find it.
Thank you for
Thank
accepting
you.
our
Have a great
invitation.
morning. Have a safe day. Be safe. Have great holidays. Bye-bye.